Now, in the second section, we will talk about some types of the laryngeal cancer. And as I mentioned in the previous section also, that the different types of the cancer depend on their location or site of the development. And then we have three types of laryngeal cancer. Depending on the site, we have the supraglottic, glottic, and then the subglottic type of the laryngeal cancer. So supraglottic cancer, glottic cancer, and subglottic cancer. Supraglottic cancer is less frequent than the glottic cancer. So supraglottic cancer is not as common as the glottic cancer. Supraglottic, above the glottis, that's the diagrammatic presentation of the supraglottic cancer. Majority of the lesion in this case on the epiglottis. Epiglottis is the fold or flap that closes during the swallowing so that to prevent the entry of the food into the trachea. So supraglottic region contains the epiglottic fold, epiglottis, all that regions they can be involved, but the most common site is the epiglottis. Order of lesion spread is epiglottis. So from the epiglottis, it goes to the false chords, and then from the false chord, it goes to epiglottic folds. So we have epiglottis, false chords, epiglottic folds. Spread of the laryngeal cancer is it can spread locally, invades the adjoining area, valvula, base of the tongue, piriform fossa. So all these are the site where the supraglottic cancer, which is mostly involved, the epiglottis can spread. It can spread locally to the surrounding areas. Cancer of infrahyoid epiglottis and cancer of anterior ventricular band, they extend into pre-epiglottic space, penetrate thyroid cartilage. So these are the, if it is present in the infrahyoid epiglottis, anterior ventricular band, it can extend into pre-epiglottic space and penetrate thyroid cartilage. So this is the spread of the supraglottic cancer. Symptoms are the supraglottic growth is often silent. Hoarseness is the late symptom. Pain in the throat, dysphagia, referred pain in ear, mass of lymph nodes in the neck, weight loss, respiratory obstruction, and halitosis. All these are the symptoms associated with supraglottic type of cancer. It is often silent. No symptom cannot present, any patient does not have any presenting features, but if they are present, it can cause hoarseness of the voice, pain in the throat and difficulty on swallowing, referred pain in the ear, mass of lymph nodes in the neck. Here you can see the swollen lymph node. Patient has a weight loss and there is respiratory obstruction and halitosis, bad foul smelling breath is present. So all these are the features associated with the supraglottic cancer. The glottic cancer, now the cancer that is in the glottis or glottic region, that's the middle region of the larynx, most frequent site. So glottic cancer is the most frequent cancer, most frequent site of the cancer is the glottis. There is free edge, upper surface of vocal cord in its anterior, cord in the middle third. So most frequent sites are the free edge, upper surface of the vocal cord, and the middle third of the cord. All these are the sites for the glottic cancer. So we have involvement of the free edge, upper surface of the vocal cord, and the middle third of the cord. Spread now of the glottic cancer, again it can spread locally, local spread, anteriorly to anterior commissure, then to opposite cord, posteriorly to the vocal process and arytenoid region, upward to ventricle and false cord, and downward to subglottic region. So if you see, all these are the areas surrounding the glottic region of the cortex, different direction if it spread, anterior to anterior commissure and then to opposite cord, posteriorly to vocal process and arytenoid region, upward to ventricle and false cord, and downward to subglottic region. So all these sites can be affected superiorly, inferiorly, posteriorly, anteriorly by the spread of the cancer. Next, vocal cord mobility unaffected in early stages. Fixation of vocal cord indicates spread to thyroarytenoid muscle. This is a bad prognostic sign. In caudal lesions, few lymphatics in vocal cords. Nodal metastasis never seen in caudal lesion unless disease spread beyond membranous cord. So the spread, again, mobility of the vocal cord is not affected in the early stage of the cancer. The vocal cord becomes fixed, that indicates spread to thyroarytenoid muscle. That's a bad prognostic sign. And in caudal lesion, few lymphatics in vocal cords are affected. Nodal metastases are not present, and then we have unless disease spread beyond membranous cord. Next, what are the symptoms of the glottic cancer? Again, hoarseness develop early as compared to supraglottic when the hoarseness is late. So hoarseness is present, early detection of the cancer, lesions affect vibratory capacity of the cord. So the mobility of the cord is affected. That can cause the early detection of this cancer because the symptoms are now more serious as compared to the supraglottic type. So next, increase in the size of growth, accompanied edema or cord fixation, stridor and laryngeal obstruction. All these symptoms are present and they develop early, leads to the early diagnosis of the cancer. So mobility of the cord is affected. There is increase in the size of the growth. There is edema and cord fixation, stridor and laryngeal obstruction. Subglottic cancer. Now the third type is the subglottic, present in the lower portion of the larynx, subglottis. Below the glottis here, that's the picture of the subglottic cancer. Account for 1 to 2% of laryngeal cancer. So far we know that the glottic cancer is the most common type of laryngeal cancer. The subglottic is only 1 to 2%. Subglottic region extends from glottic to the lower border of cricoid cartilage. Lesions of this region are rare. Spread occur to the growth starts on one side of subglottis, spread around anterior wall to opposite side downwards to trachea. So we have spread occurs to the on one side of the subglottis and occur to the opposite side and downward to trachea. That's the spread of the subglottic cancer. Here you can see that's the subglottic and that's the tumor, and it can easily spread to the trachea here. So it can spread downward to trachea or to the opposite side. Upward spread is late, it does not occur early. Hoarseness is not an early symptom. So far we know glottic cancer is the common cancer of the larynx, and then it is early diagnosed also because of the symptoms produced by the glottic cancer. They are early, they cause hoarseness and they cause decreased mobility of the cord, and they can grow, increase in the size. All that can lead to the early diagnosis of the laryngeal glottic cancer. Next, the spread also, subglottic growth can invade to cricothyroid membrane, thyroid gland, ribbon muscles of the neck. Lymphatic metastases go to prelaryngeal nodes, pretracheal nodes, paratracheal nodes, and lower jugular nodes. So all that is invade the subglottic cancer can spread to the cricothyroid membrane, thyroid gland, ribbon muscles of the neck, and lymphatic metastasis of the cancer subglottic can go to all these lymph nodes. Prelaryngeal behind the larynx, pretracheal behind the trachea, paratracheal surrounding the trachea, and lower jugular nodes. All these are the lymph nodes affected by the lymphatic metastasis. Now the symptoms of subglottic cancer, we have stridor or laryngeal obstruction. Hoarseness in subglottic cancer indicates spread of the disease. It means this disease is already spread. Late feature of subglottic growth. Infiltration of thyroarytenoid muscle. Involvement of recurrent laryngeal nerve at cricoarytenoid joint. So that was all about the section 2. Thank you for watching sqadia.com.